Hello, I'm Heydarian and I'm with you by a new video about serological tests for COVID-19, IgG and IgM antibody. Please subscribe me for more videos. Antibodies are a crucial component of immune system that is secreted by immune cells and they are in 5 different classes. That the most important of them are IgG and IgM. First, let's see a brief view of them. IgG has a Y-like shape that each end of the fork contains an antigen binding site that binds a specific antigen. It's the main type of human antibody and the main factor of lasting immunity that produces an immunity against a microbial agent in the next contamination. It binds to pathogens and neutralizes them. IgG activates other immune system mechanisms such as complement system, antibody-dependent cell-mediated cytotoxicity, and intracellular antibody-mediated proteolysis. IgM. IgM is the first antibody that appears in the response to initial exposure to an antigen. IgM has a 5 branches structure containing antigen binding site in each fork. Therefore, it has 10 capacities to bind to antigens. If we look at the corona antibody production chart, it shows that antibodies produced in the early second week of contamination. IgM reaches to peak in the third week and then reduce in production. IgG is produced in the second week too and reach to peak in the fourth week, and it remains high at least for 3 months. And it's a reason for a booster dose of COVID-19 vaccine to rise high this antibody again. The sample for this test is blood and this examination do with serum part of blood because it takes at least a week after contamination to COVID-19 for the body to produce antibody against it. This test is not used to diagnose the disease, but it can determine the phase of the disease. The most important application of this test is epidemiological studies to determine the immunity of a community against coronavirus and also to determine the effectiveness of the COVID-19 vaccine. An individual evaluation of immunity level against coronaviruses, but as a CDC recommendations because of different vaccines induce antibody to specific viral protein targets, antibody testing is not currently recommended to assess for immunity following COVID-19 vaccination. Therefore, if you want to do this test, you have to show that the laboratory kit antibody is detectable for your vaccine brand. Now let's interpret the result. If IgG and IgM are both negative, shows that you are not infected with coronavirus or you are in window period and the blood level of these antibodies are not detectable now. If just IgM is positive, it shows you are in the earliest stage of first contamination to coronaviruses. If both of them are positive, it shows that you are in the active phase of infection. And if just IgG is positive, it shows you are in the late phase of disease or you are reinfected to coronaviruses. Thank you for your watching. Don't forget to click on subscribe link. Be in health and goodness. Bye.